right, time to talk about actually a really cool drug when used correctly. And here's the problem: is we don't use it correctly, so therefore a lot of people don't get the access to it. But it's very important, especially with it's growing with our sepsis use. So norepinephrine, and let's talk about the differences between epinephrine, norepinephrine, and why this drug has a lot of good uses, again, when used correctly. It is becoming to that go-to drug in sepsis, okay? Trade names are Levophed, Leventerol, noradrenaline. You might hear those, but we use the phrase. We used to give this a lot earlier in my career for shock, and we used to kind of jokingly say Levophed leaves them dead, which is probably a halfway decent true, because, again, we were using it in the wrong way. So let's talk about the right ways to use it. All right, it's there to treat when you got a medical condition or procedure which is causing hypotension, and it's causing it because of vasodilation. Okay, and that's the really important thing. It is a sympathomimetic. It is, again, naturally made in our body. A lot of neurotransmitters in our body use norepinephrine, but it's got alpha and beta adrenergic agonist. Okay, so that means it works just like that, but it is primarily alpha, and I want to stress that so much. I want to stress that it is primarily alpha. Okay, it's going to cause incredible vasoconstriction when you give it. All right, and I figured I'd throw Ben in there for good measure. Again, it's a it's alpha and beta 1 adrenergic agonist. Okay, so it is going to speed up the heart just a little bit. Okay, but the biggest thing is it's going to really clamp down the vasculature, okay? And when I say really clamp it down, I mean really clamp it. One of the telltale signs that somebody's on a Nippy Drip is you look down at their arms and legs and they're purple, okay? And again, usually because of the sickness and what they are, that's kind of a expected thing with norepinephrine use. And it's actually one of the reasons is actually giving norepinephrine for a very long time is actually kind of dangerous, okay? So again, it onsets in 1 to 3 minutes. It wears off in about 5 to 10 after you discontinue it. It does actually wear off pretty quick. So again, it's inotropic support. It helps with the squeeze a little bit with the blood pressure less than 70 millimeters of mercury. But again, it does a lot of vasoconstriction, a lot of alpha properties. Okay. So that's why we like to use it when you've got some sort of septic issue, if they've got a spinal cord injury, if they've got poliomyelitis, where their vessels are popping out, okay? They're swollen, okay? And so again, good old Mark Ruffalo there, he's going to turn into the Hulk. Yep, I'm on Norepi, right? So again, some of the side effects we're going to get from this: it raises blood pressure. Unfortunately, it keeps you awake. It's going to cause some anxiety because remember, it is a neurotransmitter, okay? So there's dysrhythmias and tachycardias that can occur because of it. It does sort of eat myocardial oxygen because, again, it does increase squeeze a little bit, and it increases speed just a slight bit so you can get those problems. So you're going to get angina or cardiac ischemia because, remember, it's going to do all of your vessels up to and including your coronary vessels, okay? So it's important to remember that. The other thing is you can get, if it's not given inside the vein, you can actually cause gangrene and tissue necrosis. And actually, if you use it correctly, actually your feet, your legs can get gangrenous, okay? So, and again, one of the other vessels that it happens to shrink is your renal vessels, okay? So it will decrease the urine output. So again, there's a lot of bad side effects, but if you're talking about a septic situation, then that's a definite situation that you want to use it. If you have hypovolemia, correct the hypovolemia, okay? Profound hypoxia or hypercarbia, if they have hypertension, you don't want to use this drug. Kind of makes sense. It raises blood pressure. We don't want to raise it anymore. So again, mesenteric or peripheral vascular thrombosis. So you can get, and the reason that this happens is because it shrinks down all those vessels, and so therefore you get blockages in those vessels. Okay. Again, alkaline solutions can deactivate it, so we don't give it with sodium bicarb or calcium chloride. Again, just like any other catecholamine, by the way. The beta-adrenergic antagonists that can blunt the inotropic responses. So again, most of the time, that's why I said you get very little squeeze effect because of it. And by the way, if you got the sympathopometics and the phosphodiesterase inhibitors, Viagra, they can exacerbate the dysrhythmia response. Okay, so again, you got to kind of be careful if they've been on the old blue pill there, because again, it can cause problems. Blood pressure and cardiac monitors have got to be put on this patient, and you really should have an arterial line if you're going to monitor these guys. You really should. Truth be known, critical care should probably be taking it. If not, you got to take a blood pressure at least every 3 minutes on this patient. Use cautiously in your patients with hyperthyroidism or heart disease, okay? Because again, it can cause some major problems. Do not, I repeat, do not use it with pregnant patients, because not only will it will cause the shrinkage of the vessels in mom, it will also cause the shrinkage of the vessels in the baby, which will end up causing fetal anoxia, and therefore you're going to kill the kid. So it's a really bad idea to use norepinephrine on these guys. It should be given through a stable vein, making sure that it is open. I would flow at least 500 cc's of fluid through it to make sure that I had a good patent line, okay? And ensure your IV is, again, make sure that it's clear, it's flushed, it's good. And then use an infusion pump. You need to make sure that you got a precise flow on this. This is another one like dobutamine, or you really do need it on a pump, okay? Truth be known, you really need this on a pump. Now, again, if you don't have a pump and you're doing it in the back of the truck, we're going to give you some directions about how to do that. Usually what we do is we make 1 milligram, we put it into a 100 bag, which gives us a concentration of 10 mics per ml. And then we started at 0.5 to 30 mics per minute. I almost said kilograms per minute, but there's no kilograms with this one. So you usually start it really low and then work up, okay? And your average adult dose is 2 to 12 mics per minute. And again, we don't use it in the kids, guys. Use an epi infusion if you're going to use a catecholamine in kids, okay? Norepi should only be done if the doctor very specifically says it. And I can pretty much tell you that they're going to go with a Nippy Drip 99 times out of 100. So if we got a sepsis alert, and again, this is becoming a standard with sepsis, especially when we have end-stage organ failure. So if we got kidneys starting to shut down, we got additional body functions starting to shut down, again, we got to get the blood pressure up on these guys, okay? And again, we usually put 1 in 100, and it gives us a concentration of 10 mics. We started on a 60-drop set at 15 drops a minute. That gives us 2.5 mics. And then we usually work up to a max, and this is gauged off of the blood pressure. So we'll set it, we'll check their blood pressure, we'll go up if we need to, check the blood pressure. So we really do titrate this off of the blood pressure. But once we get to 1 drop a second, 60 drops a minute, we really need to kind of hold off, because that's kind of the max that we should do it. And again, try to have it on your pump if at all possible. And give at least 1 liter of fluid for sepsis in cases before starting a Norepi drip. I'm going to stress that again. Give at least 1 liter. Preferably, I would say 2. Maybe even work on a 3rd one. Okay? But make sure that they are not hypovolemic. That is so very important. Otherwise, the Norepi is not going to work. Again, we usually give it via IV infusion only. Folks, we don't give it to pregnant patients because, again, it can cause fetal anoxia. We don't want to use it. I know it says a class C and D. I'm going to reiterate, we don't use it in pregnancy, okay? Again, it can cause some major damage. All right, that's going to do it. Again, Norepi, a lot of people are scared of it. Don't be scared of it. It's actually a really good drug. Again, we only maybe give it 2 or 3 times a year, but with the prevailing sepsis that keeps going on, the things that we keep going to in sepsis, that's kind of a norm, all right? So I'm going to see you guys on the next one, and again, don't be afraid of the old Levophed. See ya.